Medcom presents Insertion Procedure for the Hemocath SL15C Double Lumen Catheter. This catheter is designed for the percutaneous insertion in the jugular, subclavian, or femoral vein. Please note, do not use this catheter in thrombosed vessels. The Hemocath SL15C is aseptically packaged with all necessary supplies including introducer needle, introducer catheter, guide wire, scalpel, silicone double lumen catheter with integral stylet, injection caps, suture, and sterile dressing. The catheter is also available in kit form and comes with drape with fenestration, gloves and mask, local anesthetic, PVP-1 ointment and PVP swab sticks, injection ports, sterile saline, and heparin in concentrations approved by your institution. Please note that catheters must be inserted under strict aseptic conditions in either an operating room or a bedside unit equipped with fluoroscopy. Always perform an EKG to detect any unsuspected cardiac arrhythmias. Preoperative procedure for the SL15C catheter is standard for catheter implantations. It may be inserted under local anesthesia supplemented with sedation. First, prepare the skin at the insertion site with a povidone iodine scrub. The prepped area should then be draped with sterile towels. Flush and fill each catheter lumen with saline. The right side is used as it offers a more direct route to the junction of the right atrium and superior vena cava. The landmarks for the supraclavicular entry are the acromion process, the sternal notch midway between the two, a sonometer medial, and a sonometer cephalad. Next, infiltrate the skin with lidocaine, aspirating as you go. Using the introducer needle, make the insertion about 20 degrees up from the clavicle, 20 degrees up from the coronal plane. Once the vein is located, the skin is anchored and the needle is held in place while the syringe is removed. Place the thumb over the needle to occlude needle to reduce risk of air embolism. The wire guide is then threaded into the needle with no resistance. The patient's pulse is monitored for any arrhythmia. Now remove the needle with the wire guide remaining in the vena cava, maintaining constant contact to avoid wire embolism. Next, a small nick is made in the skin with a supplied scalpel. The small tissue dilator is introduced over the wire guide, then pushed into the vein. Once the vessel is dilated, the dilator is pulled out, being careful not to remove the guide wire. Now, the catheter is threaded over the wire guide and fed into the vein. The tip of the catheter should be positioned in the superior vena cava at the junction of the right atrium. Once the catheter is properly in place, the wire with stylet is pulled out until it exits the venous lumen. Flush both ports with heparinized saline solution for a sure and adequate return of blood. X-ray verifies tip is positioned in the superior vena cava at right atrium junction. The insertion procedure is now completed. The catheter is sutured with a 3/0 silk suture to the hub of the catheter. The heparin locks are then closed with a heparin concentration of 5,000 units per milliliter of saline, and injection caps are attached. Finally, the insertion site is dressed.